How many grafts would I need for my first hair transplant procedure?
Thank you for your question. You submitted your question with a single photo of the top of your head, and you're asking a very common question. How many grafts do you need for your first transplant? Well, I can certainly share with you a perspective that I think you may not always get from people who are only looking at this from a purely surgical transplant perspective. A little bit of background: I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial plastic and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years. I'm also the founder of TrichoStem Hair Regeneration Centers. This is a system that we developed which ultimately has defined a new category of hair loss treatment with regenerative medicine technology, and we treat patients from around the world, men and women, with genetic pattern hair loss. And certainly we've treated a lot of patients who have a similar appearance as yourself. So it is certainly a natural question to ask, how many grafts do you need? Well, it's also important to understand other factors that impact the success of your potential surgery. So when we evaluate a patient who comes in for hair loss management, as I mentioned, we developed this hair regeneration system that was used at the time when we were doing a lot of hair transplants. When you do a lot of hair transplants, you learn very quickly that there are many challenges in getting successful outcomes. Patients always want much more hair than is practically often the case to be able to actually deliver. Why is that? Well, when you look at the top of your scalp, you have a fairly advanced degree of hair loss. Now, when you look at the donor area, you have to look at how much hair there is that can potentially be transplanted. Now, the quality of coverage is dependent on the density of your donor area, which means if you have higher density, you have more hair that you can transplant, and if you have thicker hair covers scalp better than thinner hair. Generally speaking, that is really something that can only be determined during time of consultation. And when you look at the absolute amount of scalp that needs coverage, you cannot get enough grafts, even if you do multiple transplants, to get 100% coverage comparable to before you started losing hair. Now, generally speaking, it's the desire for every patient to have as much as possible, but I would say most people are realistic about the kind of outcomes they're willing to accept. And basically, as explained often in consultation, is hair frames the face. So you want to at least have some type of defined frontal hair line, but you also don't want to look pluggy, so you need hair grafts behind. Now, with hair regeneration, we learned a lot about the process of helping people during transplant, but then when we saw that not only did hair grafts heal better and the donor area healed better, but that thinning hair became thicker, I basically asked a different question. I asked, what can I do for patients who are experiencing hair thinning, who are willing to have hair transplant, but what if we did just the injection alone? Well, the results actually changed the way I practiced, the way I manage patients with hair loss. When someone is ready for transplantation, it's very important that someone like yourself also think, how can you slow down the progression of your hair loss and get maximal coverage? Transplant is not a cure for hair loss, and progression can leave a lot of people who have had transplants looking not as good as they would want. So whether it's using a drug like finasteride to help slow down the progression, as well as the technology that we've developed called hair regeneration, when we meet someone like yourself, we have developed a classification system that is a way to help patients understand how much improvement they could potentially get and how to strategize the coverage that we're able to achieve with any future transplantation. We look at your current age. We look at the age that you started losing hair, the degree of your progression, the rate of your progression, previous medical interventions and how successful they were, as well as other medical variables. That being said, you have to understand also the long view. So for a younger person considering transplant, the perspective and planning is going to be very different than a middle-aged person considering transplant. And in situations like yours, I have been often quite impressed by the effectiveness of non-surgical treatment. So using something like hair regeneration, I have drawn the conclusion that a lot of times the results that we've gotten, even with people with advanced hair loss like yours, we've gotten results that exceed not just 1, but 2 hair transplants. Now, when it comes to hair, very often people are very ambitious about how much hair they want to have on their scalp. And the ambition is often challenged by the limitations, whether it's transplantation in terms of donor area or the limitations of hair regeneration with actual salvageable hairs. I always explain to our patients that hair loss is progressive and there is no cure, but there is management, and management is a function of the relative density and thickness of hairs and the longevity of the hair growth cycles that can be achieved within the genetic permissibility. And further, that being proactive is so much more effective than being reactive. So I think that you can certainly get consultations, and you're going to get a wide range of ambitious, speaking of ambitious, ideas about how many hairs can be placed and how much of a result you can get in terms of number of grafts. But remember, it's not just the number of grafts you get, but how well they survive. But I would assert that in a strategic way, maximizing coverage non-surgically is strategically valuable in being able to plan out a better hair transplant. Because every hair that is reactivated, grown, and provides coverage is an area of scalp that doesn't need a graft. And therefore, you can be certainly much more, you can optimize the strategy of using transplant. So a lot of our patients come to us, like you, having advanced hair loss, and then once we've maximized their coverage, they then move forward with the transplant. And it works in synergy. So learn more about medical and this regenerative medicine technology, and of course, learn more about hair transplantations and see what are realistic potential outcomes that you can achieve. So I hope that was helpful. I wish you the best of luck. Thank you for your question.